Morning, friends. Today, I have to see about Kgmu model paper. First question is the most common pathogenic mechanism of acute pancreatitis. It's autoregulation of pancreas. What does the nurse monitor for in a patient with acute renal failure? There are two things: only a pulmonary edema and the ECGNS. A disease caused by the Treponema palladium is syphilis. Which of the following is an important nursing intervention for a patient with the Cushing syndrome? It's it from protect from infection. Involvement of which of the following features will lead to right-sided hemiplegia and aphasia? The answer is left middle cerebral artery. Which one of the following is a common response expected in a patient with stroke to change in body image? The common response is depression. A patient with the early osteoporosis must be advised to quit smoking. For doing a nasotracheal suctioning during which of the following patient activities the catheter should it be inserted? During inhaling, the simple most effective method for reducing the risk of stasis of pulmonary secretion is second hourly position changes. What is cyanosis? Bluish discoloration of the skin. The period from conception to birth is noted as prenatal. The role of nursing in having charge of somebody health. Whose vision is this? It's a vision of Florence Nightingale. Which of the following developmental stage corresponds to infancy? Infancy is trust versus mistrust. Who proposed the theory of self care deficit? Oram theory is a self care deficit. Normal head circumference of the infant is 33 to 35 centimeter. Leading cause of death in adolescence. Leading cause of death in adolescence is accidents. The legal definition of death that facilitates organ donation cessation of function of brain. The body temperature at which tissues and cells are best to function is 36 to 38 degrees Celsius. Men have high basal metabolic rate because their body contains more testosterone. The mechanism by which the body loses heat to environment without having direct contact is called radiation. Those having more types. One of the type is radiation. Which are the following such as control the heat loss? Posterior pituitary. It's hypothalamus. Exposure of the body to subnormal temperature can lead to frostbite. What is the effect of antipyretic? Antipyretic is reducing the fever. The volume of blood pumped by the heart during 1 minute is called cardiac output. What is normal pulse rate of the infant? Infant is 120 to 160. The phase of respiration in which gases move in and out of the lungs is called ventilation. Which is the normal partial pressure of the carbon dioxide in the arterial blood pressure? Blood. It's 35 to 45, seen in ABG. What is the equipment that directly measures the arterial oxygen saturation? Is pulse oximeter. What is the term used to denote regular abnormal slow respiration? Bradypnea. What technique of assessment helps in determine ketoacidosis olfaction? Inflammation of the skin at base of the nail is called paresthesia. The condition in which both eyes do not focus on an object simultaneously is called strabism. Strabism is an important question. Most effective way to break the chain of infection is by hand hygiene. Hand hygiene is the most important question frequently asked. How many drops is standard drip set makes 1 ml? 15 ml. A prescription of water of 0.125 mg reduction orally and tablet contain 0.25 mg is available. How many tablets will you give? Administer now? We give half tablet.